Greetings, everyone. Welcome to the Diabetes Prevention, Food Sovereignty, and Access to Ancestral, Cultural, and Healthful Foods webinar. We're going to start in about 1 minute. And please feel free to introduce yourselves in the chat. And to keep us on time today, I'm going to just jump right in a moment here. Play some vibey jazz music for you to transition from whatever you're coming from into this space. And a note that you're welcome to introduce yourselves in the chat. You're welcome to not introduce yourselves in the chat. And we will be sharing the recording and slides from today in a follow-up email to all registrants, as well as on our website. So don't worry if you have to leave early or if you're joining late. Thanks so much, everyone, for joining us. My name is Kara Skillingstead. I use she, her pronouns. And for those of you who cannot see me, I'm a mixed race woman in my mid-30s with brown hair and olive skin. I have wire-framed glasses and am wearing a black sweater. And my background is an ocean and some grass. I'm calling in today from the unceded, stolen, and colonized traditional land of the first people of Missoula, the Confederated Salish and Lower Kootenai tribes. I honor with gratitude their stewardship of the land and waterways of this region from time immemorial and their continued contributions to the community and land to this day. I encourage y'all to read about the treaties and history of the indigenous peoples on the land in which you currently work or reside. And if you're not an Indigenous person, please consider paying rent to whichever Indigenous peoples inhabit the land on which you currently work or reside. And if you don't know who that is, we will share a link in the chat so you can learn more and find out. And you can visit native-land.ca. So many folks are familiar with Zoom, but we are in a webinar today, which means that all of your cameras and audio are turned off. And we encourage participation in the chat and Q&A box, as well as with the reactions, buttons, and emojis. And wanted to remind you that there are keyboard shortcuts for those of you using keyboard shortcuts, and you are welcome to turn on the closed captions. For any other access needs today, please message me or Ivy in the chat. And for my access needs today, as you may be able to tell, I'm reading from a script. So slides are going to be continually shared in the chat throughout the session for those who do better following along on their own. And we will release a transcript of this session along with the recording. This National Learning Series is sponsored by the Health Resources and Services Administration, or HRSA, and is a continuation of the Special and Vulnerable Population Diabetes Task Force. For more information about the Population Health Management Task Force or to see archive materials from the Diabetes Task Force, visit pophealthtaskforce.org. I want to briefly acknowledge the 12 National Training and Technical Assistance Partners, or NTAPs, who support this and the other sessions in this series. You can read more about each one at pophealthtaskforce.org/NTAPs. And this webinar is part 3 of 4 of the Population Health Management Task Force National Learning Series. To see the recordings, slides, transcripts, and resources from the other webinars, you can visit pophealthtaskforce.org/NLS-24. Since this project is sponsored by HRSA, we want to name that we have no conflicts of interest to disclose. Again, I'm Kara Skillingstead, Associate Director of Healthcare Transformation at the Association of Asian Pacific Community Health Organizations, or APCHO. And I wanted to briefly acknowledge the other collaborators for this session: Monica Garcia from MHP Salud, Abba Anisin Amu and Cindy Selmy from Health Outreach Partners, and Ivy Yusin, also from APCHO. For this session today, the learning objectives are to describe the relationship between diabetes, food sovereignty, and connection to cultural food systems, identify barriers to accessing ancestral and healthful foods among health center populations, and explore programs and partnerships to enhance food access and connection to cultural and ancestral foods. And one note is that we will not have time for a live audience Q&A today. We encourage audience participation throughout the session via the chat and Q&A and have encouraged the speakers to answer your questions directly in the chat throughout the session. We will be de-identifying any questions and answers from the chat and sharing via a link for anyone watching the recording as well. Okay, before we hear from our presenters, we want to ground you all in this topic. And we know that there's a spectrum of familiarity with the terms, concepts, and ideas from this session. So we want to give a foundational overview of why we're gathering around this topic. And then our presenters will do a deeper dive into the historical and contemporary contexts, as well as provide some actionable examples for what health centers can do. So with that said, health center populations often exist at the intersection of multiple marginalized identities and are therefore disproportionately impacted by disruptions in food systems. Increases in climate chaos, such as temperature extremes, shifting weather patterns, and increased frequency and severity of natural disasters, has had multiple impacts on health center and other populations, including but not limited to devastation of ecosystems leading to interruptions or destruction of food systems, widespread global displacement disproportionately impacting communities of color and the global south, increases in the number of climate refugees migrating to the continental US and Hawaii. And these factors mean that increasing numbers of people are relying on more and more unstable food systems, while globally people have less access to cultural and ancestral foods. Just a quick visual from the Othering and Belonging Institute's Climate Displacement and Resilience database. This map shows the concentration of people who are displaced by climate change and the disproportionate impact on countries in the global south, particularly those who are formerly or currently colonized and therefore not responsible for the degradation of their ecosystems and other factors that exacerbate climate change. So the relationship between food, culture, and health is deeply intertwined. And while food insecurity can increase the risk of diabetes, hypertension, and other chronic conditions, eating familiar cultural and ancestral foods supports physical, mental, and emotional health. Integrating a culturally tailored diet plan that incorporates patients' cultural and ancestral food traditions can foster trust and improve adherence, which leads to better health outcomes. Food is medicine, and access to nutritious foods is essential for managing chronic conditions like diabetes. Despite the longstanding knowledge of this concept of food as medicine, many communities, both historically and today, experience poor access to affordable and nutritious foods. For example, migratory, immigrant, and refugee populations are often forced to relocate to low income and rural areas with poor geographical access to their cultural and ancestral foods. Many indigenous populations, as a result of colonization and forced relocation, no longer have access to their ancestral foraging, hunting, and growing lands. Many communities who are most embedded within the food system, such as delivery drivers, restaurant workers, and factory employees, experience job instability, low wages, lack of benefits, and many fall below the federal poverty line and are just one paycheck away from being unhoused or in a crisis. And last, and most ironically, farm workers who create the foundation of food systems are often invisibilized and exploited, while structural inequities and exclusion from social services like SNAP bar them from accessing the very foods they help to cultivate, harvest, package, and deliver. I should also name that this is not an exhaustive list, and these are not all the communities who struggle with access to healthful and affordable foods. Just throwing it out there. All right. Lastly, many Asian Americans, Black, Indigenous, Latine, Pacifica, and other historically racialized communities bear a complex historical legacy that has significantly shaped their relationship with both food and healthcare systems. The experience of colonization, exploitation, displacement, and dispossession of land and rights has left deep scars that continue to influence the perspectives and challenges that communities of color face, including their interactions with food systems and institutions like health centers. Further, intergenerational trauma and racialized stress can actually alter DNA to make patients more susceptible to chronic illnesses like diabetes. And providers, community health workers, and other health center workforce who acknowledge the experience of minoritized and racialized communities, alongside with the significance of access to cultural and ancestral foods can build trust and lead to more culturally responsive and personalized dietary and lifestyle resources and recommendations to improve health outcomes overall. So, that is quite enough of my voice. And it is now my pleasure to introduce our first speaker and subject matter expert, Kiana Mickey. Kiana is a New York City based food systems leader and speaker that uses food as a driver of enterprise, innovation, and equity. She also brings an equity driven lens to her local, state, federal, and international policy work on issues such as food sovereignty, land stewardship, and health. She's currently consulting on multiple policy, food enterprise, cooperative startups, and equity driven projects locally and nationally. Thanks so much for joining us, Kiana. Passing it over to you.
Oh, thank you so much, Kara, and thank you for the context and the grounding that you're sharing with us. And uh, I just wanted to have a quick check, and I didn't ask in advance. Am I populating the slides, or will you be able to move them for me? You're
I can
already
move them
there.
for you. You can
I
say
really
next slide.
appreciate it. Sorry about that. Thank you. Thank you again for this quick time that we have and the time for me to share from working in food and agriculture systems and how there are intentional ties to cultural food sovereignty, and how we can plant those seeds of ideas that I'm hoping y'all can bring into your work. I really see y'all as the experts in your communities, as addressing some of the needs and issues, statistics around population health. But my goal here is to kind of bring to context how we can bridge what we often talk about in our equitable food and farm systems work, talk about in terms of agriculture, or, and how folks grow their food, and those kind of elements around our food systems and how to bridge that work. And I see this also as a quick opportunity of reciprocal learning. Like, I am learning as well as being here, as well as sharing some of the information. But it's all kind of grounded in our many cultures and our intersections. So oftentimes we hear the term food is medicine, but what the reality is, we are often disconnected to our actual ancestral foods. Oftentimes our culture is not present in the models and work around connecting food and medicine, or how to heal, or address our disparities. And we oftentimes don't use in the model of food as is medicine, the centering our community. So we might be engaging them, but we're not actually centering their knowledge, experience, their history, their cultural food ties and pathways. So to me, I think this is a missed opportunity. And I think the connection between the power to grow community and grow food, but it also connecting cultural food and seeing it as a tool, as food is medicine, can also bring about solutions that are feasible in the hands of the most impacted. So if we move to the next slide, I'm using the term food system, and I wanted to make sure that I start here and kind of ground on what is even a food system. Now, this can be defined in different ways, and we can also look at it at different levels, from local to global. It's all, there's some prevailing terms. I'm sharing one down here from the USDA National Library, everything from farm to table. So pretty esoteric, but I think it's trying to capture this complex network of systems. And so you might see in other conversations and other literature, either it's kind of oftentimes described or visualized as a linear flow of food. Oftentimes it's also kind of mixed with different like graphics. What I think is important here is not so much the reference of what it looks like, but maybe highlighting what we want, what is a food system and what we want to see in a good food system, and how that connects to centering folks in a cultural-based food system. So, I think a definition I'd like to share here is that it's really about the food system itself as this complex network of systems that connects our agriculture, our ecosystem, our flow of food from production to manufacturing to processing waste, all the access, distribution, and how that system kind of works together. And if we move to the next slide, if that's kind of a prevailing term of like the food system, I wanted to start with starting from abundance. And let's think about like a good food system. So if those are kind of the baseline like buckets, I think the Michigan Good Food Charter offers a really good and clear way of kind of highlighting some of the elements that we would want to see in a functional food system, a good food system, and highlighting here some of the elements around accessibility, fairness. So we're not just talking about food production, we're also talking about the exploitation, erosion of our natural resources, as well as exploitation that oftentimes comes in our food systems around labor. The accessibility to of the food and that flow in terms of, is it culturally relevant and healthy, sustainable, healthy, equitable, and diverse. So to me, I think these are like those key elements that we want to see in a food system when we're thinking from production, or from, farm to table. Like, are these elements at that, in that course of action? And if that's the elements that we're bringing. And oftentimes when we think and we look at our current food system and how we engage, oftentimes these are elements that are missing. We're not really seeing a just and fair inclusion of our the most impacted people in order to make those decisions on what the food system is and who's being a part of it. We're not seeing the diversity of scales from small scale farmers to large scale farmers, and even just the regenerative practices that we know are good for the land and for people. So if we go to the next slide, now that's like a good food system if we're just starting kind of overarching. And, just kind of also highlighting some of these other elements that oftentimes we do feel and see in our current food system. And I'm sure these are things that are familiar with quite a few of us here. There's a reliance of processed food, a reliance on the industrial food system, and kind of bringing in not just processed food, but food at the end of its life cycle to our communities in a form of security, or addressing emergency food needs, or addressing the need to kind of balance that nutritional gathering those nutritional calories. Oftentimes, it's not even food of the people. Where, oftentimes when we look at our food system, it's very dominant on our dominant diets, American diets, Western diets, that we know can often be low in nutrient dense food, but oftentimes when we connect to our cultural food, and we'll continue to talk about that, we know that there's a quite different opposite to that in terms of healthy, fresh food, vegetables, and legumes. But, the other connection I wanted to highlight too is that this current food system, with this reliance on a system that brings in food or processed food in our communities, it keeps people out of it. So it's actually not just exacerbating disproportionate health outcomes, in particular in the communities that you all are serving, but it's also disconnecting those folks from our natural ecosystems. It's disconnecting us from the land. And if we're disconnected from the land, then we have even less power on deciding on what we're growing, who's growing it, and how we get it into our communities. And also the environmental factors. It doesn't account, and I think folks are really continue to be familiar with those examples of what came up in COVID, when that main industrial food system really broke and hit a stall, how vulnerable our food supply chains were. But when we think about being able to think about a local food system and also centering people, and we can transfer to the next slide, bringing people into that conversation gives us the opportunity to really highlight cultural food as the medicine, as as solution-based practices and models, and a way to kind of bring that. It brings people into the center, and it gives the opportunity to connect our ancestral as well as seasonal and sustainable practices of growing food, of tending and honoring the land. And it actually gets us as more active in the food system and less as actors and depositories for recycled food and consumers, if you will. Oh, yes. Do you mind? Oh, wait, sorry. Yeah, sorry. I lost track of my notes. Apologize. And thinking and centering people in our food system and thinking about a local food system also gives us the opportunity to be in more of the power and decision making of that complex network that we talked about earlier, that those systems and those activities. It gives us the chance to be the individuals, the organizations, even the businesses on how to self-determine the change that we want to see. Also, the reality is a local food system is more accessible to most folks. It can be as simple as growing food on your windowsill or in your community garden. It can be as feasible as bringing in herbs into healthful food and recipes and developments and approaching different foods in a different way or cooking in a different way. But it can be as important and as needed to help inform and build community with food, but also this ecosystem. It connects us closer to the ecosystem. So we're a part of it as well as honoring it. And then we're also now a part of deciding on what that food flow is. So a local food system is actually something that doesn't have to be so esoteric, like addressing the global food system. It can bring it down to the practicalities and the ways that we can do it together. And it connects people to also being the decision makers and we're more connected to power. And the reason why I also wanted to bring this up here is in terms of the work that you're doing, it can make it feel more feasible and how to bring in more folks so they can connect and bring in more work around connecting cultural food to medicine in a more direct and way. And oftentimes we know that cultural food evokes memories, it breaks bread together, it connects us to the land and the bounties. So it's all these ways that we nourish our bodies and environment, but in practical ways that we have the power to do. So I'm talking about power and I'm saying we can do this, right? And that can feel hard. So if we go to our next slide, and it's important to kind of talk about, well, how can we get there? How can we get from this current food system that, we know has been, we're disconnected from, but it very much impacts us and including our health outcomes, and how can we get to a more a people-centered food system? I believe here in your work, understanding how to get from food security to food sovereignty there are some other ways, or kind of seeing it as a spectrum of work from going from food security sovereignty, I think could be helpful in your work. Because I think oftentimes these are models that get conflated or used either in the same way or different ways. And while there isn't any one prevailing definition for any of these models, I think having an understanding of what's similar and what's different can kind of minimize the conflation, but it actually equips folks and empowers a way to foster power, connect to practical steps, and amplify people and cultural food in the ongoing work that you're doing. So if we break it down a little bit together in the next slide, this is just kind of a highlight of a visual of that spectrum I'm talking about, on how we kind of oftentimes work in the realm of food security, how different work can kind of transition and move into food justice and bring it into more power, and in a practical way, try to get us to the food sovereignty that we all deserve and want to see. So if we start in the next slide, there are some prevailing definitions that helped me kind of ground these kind of topics and these like prevailing definitions. I won't spend too much time here. And again, these are slides I'm happy to keep available and share with folks. But one of the things I kind of wanted to highlight is just those key pieces around food security, where we want that connection around, people connecting to the food and having access to it, but it's not really talking about how and where the food was grown, right? So we're really oftentimes in this food system, in this element, talking about food that's grown at a surplus, food that is actually not really addressing the exploitation of the land as well as the people. And we'll get into this more in some of the other slides, but oftentimes the folks that are most impacted are actually just receiving. They're not really in a decision-making power in a food security model oftentimes. And so it's not really built to kind of address some of these prevailing issues. Food justice has more explicit language and around the right to grow and sell and eat healthy food. It evokes the environment and knowing that there's a balance and connection, but it also brings in that we need an element of economic justice and social equity. And then via campesina and thinking about food sovereignty, there's an element here that really kind of has that baseline as food is a basic human right, policy, reorganizing our food trade, as well as other pieces and protecting natural resources. So let's get into it a little bit more. And also, I'm going to make sure I'm being sensitive to our time. So here with food security, again, oftentimes we're talking about shelf-stable food. Oftentimes fresh, locally grown food is not included in these models. These are also, again, like I said, food that's grown at a surplus, where it's donation, and oftentimes these are donated food is food at the end of its life cycle. It's also oftentimes processed or canned. So we know oftentimes it's a disconnect with our cultural meals and our recipes. It also disconnects us from being able to grow that food. It's not really putting resources into us folks being able to grow it and kind of bring our recipes right in the food to our community. And the reliance on the industrial food system is not really designed to end hunger or the disparate health outcomes. So it's very hard for folks to kind of balance their nutritional needs when they're getting food from just food security efforts and models. And these are some really broad graphics to kind of demonstrate that, but I think y'all often kind of know and kind of see that. But if we transition into food justice, here's another way to kind of think about it too, is there's more decision-making power, self-determination of community members as individuals, as also organizations and groups to kind of think about what are our connections to our systems? Are we increasing the power of the folks to be able to grow, learn how to grow? Even if it's in a community plot, like I said, a windowsill, even if it's working with larger scale growers and farmers, are we building those pathways and decisions on buying food from them or getting donated food? Are people able to kind of share? So if we think again about that food system, the food system, food justice increases the power of individuals in our community to bring in our cultural practices into that production. Think about how we share in our community. How do we make the accessibility cost? So it's not at the detriment of a farmer, and it's also not at the detriment of the consumer, but we're finding ways to find that balance on the increasing that true economic justice. And some other examples I wanted to mention too is it gives us the chance to make cultural food accessible. It also addresses the chance to really think about our ancestral foods in a way that really kind of help us. Even things like addressing waste. So not just thinking about waste is compost, which is needed, but it gives us a chance to actually build the food system, the food chain that we want to see. So one example I think in many cultures, we use and highlight sweet potatoes. And oftentimes we kind of focus on the root vegetable of the sweet potato. Now, for some folks, depending on their nutritional needs, this is an item that can be really great in their diet. And for others, maybe it's not so much the root vegetable that they're going to put on their plate or focus on, but we have the elements of the sweet potato leaves. You're not hearing in a Western diet thinking about the use of sweet potato leaves. And oftentimes, even in larger agriculture, that's even just seen as waste, something to maybe compost or just something that is just end of life. We're not even thinking about that use. But we know oftentimes in our cultural history and our food practices, we kind of use all the elements, right? And oftentimes we know that there are actual recipes that are still accessible and feasible that we could do today. So not just how to grow a sweet potato and different microclimates, but are we using the whole item? And can the sweet potato leaves also be something that is, again, another element of healthy diet and use, but also we're deciding what is waste and how to mitigate waste and how to we're not actually seeing our food as waste because we're actually using all of all of it. So here's all those kind of elements that we can kind of factor in, even if we're living in not our ancestral homes or lands, that we can build, we're living in microclimates that are either similar to where we're growing up, so our ancestral foods can still thrive in these areas, but we can also in agriculture build, even in the, a small scale setting, a little hoop tunnel, a little high tunnel, a little greenhouse that it can actually build that mini microclimate and think about the food production and elements that we want to bring. And also the cultural relevancy of food is given a chance to be honored in a system like this. So if we slide to the next slide on food sovereignty, oh, sorry, I forgot about this one. This is another great example that I wanted to highlight with everybody, is there's an urban garden, a community garden in the South Bronx in New York City that I thought is also not just thinking about an example of like the root vegetable, but also the plant medicine that we can bring into our work. This is also food justice. So it's not just the whole food that we're eating. We can also think about agriculture and our connections to food and our health. And what do we do around bringing medicinal plants and culinary herbs into our communities? Are we helping folks create models that it doesn't have to be this big manufacturing thing, but you can actually grow and dry, dehydrate herbs and tinctures, and heal ourselves. Again, things that we're able to grow ourselves, things that are items and food and herbs that come from our ancestral recipes and history. And if we can bring that here. And so this is one of those examples that I want to kind of highlight of folks doing that work. Black and brown and Asian community in the South Bronx using community garden plots for not just growing whole food, but also building a apothecary where they wanted to focus on giving folks a chance to tend to the land, give folks a chance to be educated, give folks a chance to actually process these foods into these tinctures, into teas, and then it now becomes a place of wellness, a place of community. It's also a place of cooking demos, but then you're also able to do other healthful activities and wellness activities. Like at Kelly Street, they'll connect to Qigong, Qigong, and health and yoga. So folks are at a chance where oftentimes people say, this is a neighborhood that's historically one of the poorest congressional districts. These are actually a place where people are equipped, ready, and connected to the land to actually heal themselves. And they're using, raising funds or growing the garden in a way to do it in multiple ways. So if we jump to the next slide, I think this is like one of those great transitions. And there's just some examples of the work that I was talking about. You're seeing some of the cooking demos. I also want to highlight the intergenerational component this brings as well. Cultural food as medicine doesn't only have to be seen as how to address obesity or in certain age demographics. What we also, I think, offer the opportunity here when we think about food justice is this good for the land long term? And is this nourishing our bodies? But also, is this good for other folks to be able to have these practical pieces? So again, a local food system gives us the opportunity to put that power in our hands. We can grow this food, we can cook this food. And as you can see, there are kids here, there are elders here. It gives also the opportunity to share that knowledge. So it's not just held within ourselves or only seen as a young people's issue or an elder issue. It's actually, how do we use this in different ways to kind of meet our unique needs? And I think that's something that's oftentimes missed sometimes in food as medicine work, is there's no one size fits all. We know in order to, our ancestors thrived, there were different approaches and different ways to kind of use our foods and our plants. And we need to do that. And that's kind of the lessons also through demos, through processing, through workshops that we can share. And so this is like, I'll always kind of highlight them, but I love this picture. I'm glad y'all are loving this picture as well. And I wanted to put two pictures in one, so I apologize if it looks too like crazy, but it was like too much to not put in. And then on the next slide, again, this is kind of that stretch and kind of moving into that food sovereignty. So I'm hoping is, while I feel in my personal perspective, our current food system in the global north is not at a place of food sovereignty, I think this is the goal. I do think we can continue to look at models within our communities and even in our models in other, of our ancestral lands. I look to the lands in cultures and work in the global South. I also look for inspiration around food sovereignty right now and moving forward, even folks in Hawaii. I feel like there is active work in food sovereignty, but when we look at the global north, I do not think we're the leaders. So I think this is also the opportunity where our food system needs to kind of change and kind of center global south and AAPI, HI, or, practices, because folks know best and have that connection. So we have the elements to do it. Again, there's a real connection to land. So whether it's a plot or a lot, having folks be equipped to be able to self-determine that food system, grow that food, be able to feed and nourish each other is the way that we're able to thrive. And again, I think it's not just in a demonstrative way or kind of this esoteric way of how we connect to our ancestral origins. I think it's an actual relevant way that we need to see in our food system now. We need to see cultural food is medicine now. We are on a hot planet. Climate crisis is real. And I think it's not just about echoing back to past diets. I think it's about how we bring this into our true models and our current models. And I think the traditional diets are really, or what should be our contemporary diets. And I think this is some baseline research that I found in the traditional diets and some of the impacts when looking at it from health outcomes, but I'm sure that there's more. And I'd love if there's folks that have more of this information and research to continue to lift up and share. But I just hope that this was a way to kind of connect the dots, that we know that our traditional diets of our ancestors were low in fat based on the food and how they tended to the land. We know that, in our contemporary terms around, fiber or, addressing sugar, we know that the diets before brought us here. We are those evidence of our ancestors being able to thrive, honestly, in my opinion. So I think what we can continue to do here with food sovereignty, it's not just growing the food, but I think in working in population health, it's also how do we continue to prioritize and value these type of health outcomes? How do we continue to prioritize and value connecting the dots on community-based research or thinking about research in a different way? Information about a different way around nutrition. So we're not just thinking about nutrition security, we're thinking about nutrition sovereignty, meaning how can we bring in the research that can kind of demonstrate or highlight to us what were the elements of the diets of our past, what are the elements of our food and what we need in our food systems now, again, from production to harvest to waste, that can and should be in our true food system. How do we actually use this as efforts of food sovereignty so folks have the most power to do it, but then we can actually start demonstrating some of the other health outcomes and address some of the disparities that we're facing and seeing. So I think sometimes I find in the work of food justice, we have even a disconnect amongst ourselves around how we talk about it in a social justice lens and how we talk about it in the nutrition and science and medical fields. And I feel what I'm hoping is that this kind of shows there is a definite need and opportunity for both to be there, but both can actually get the data that we want, get the outcomes that we need. And again, it's still in a way that can feel practical. And again, we're centering folks in a way that they can feel more connected to the food and the practices, that it's not in order to have food as medicine or in order to be healthy, it has to only be seen or only be done in the ways that we are oftentimes given in dominant culture or dominant health practice, that there is a way to connect it and still address the issues, the health issues that many of us are facing right now and can change the course of that. And again, I think when we talk about food sovereignty, I think one of the things I forgot to mention, I apologize, is even just that connection to land. Again, whether it's a plot or a lot, whether it's a windowsill or a feast, thank you, that we don't continue to see cultural food as a trend, but land is a place of connection. So it's not just community, it's a place of connection for community, whether these are existing folks as well as newcomers to our lands. But this is also the opportunity that land can provide to take us out of the reliance of imports, to take us out of the reliance of the foods that come in our food security models, and actually connect to practical ways of sharing. How do we grow these foods in our different lands? How do we do that now where we're living now? And also, like, from practices to models to recipes, it gives folks a chance to kind of use the land as not also the place to cultivate community as well as food. Again, echoing the growing and cooking of culturally relevant food, and also can connect us to improved health. And I think I mentioned before, but just highlighting that there are ways to kind of even build our microclimates so that we can still, again, have that self-determined approach to our food system. And in microclimates, also understanding like there's just different foods that we have grown up with, but there's probably different ways that we can approach bringing it here. So seasonality plus cultural relevancy is possible. And I'm hoping that we can continue to make these incorporations. And again, I hope these are just some of the seeds that I'm able to share so that when you go back to your work and you're thinking about how to further connect to communities, these feel like practical ways that can really center them and also move work forward and also bring maybe even new folks that maybe have just not made those connections to the work that you're doing. I'm probably more over at time, so I just wanted to offer my thanks and pass the mic to Kara for the next speaker. I just thank you again.
Thank you so much, Kiana, for that incredible overview and just all the advocacy you do for equitable food systems and for the reminder to us that including local, seasonal, and sustainable practices for enhancing food systems is just as important. So if anyone has more questions for Kiana, please share them in the chat. And I encourage all of you to check out the library of resources, talks, and papers on her website, kianajmickey.com. And we shared that in the chat. It is now my absolute pleasure to introduce Aileen Gideon and Amanda Echegoyen from the Community Clinic of Northwest Arkansas. Aileen is an advocate and educator who helps this community navigate different systems and resources in the Northwest Arkansas region and is the Special Programs Coordinator at Community Clinic. Amanda is a healthcare leader with over 12 years of experience in community health centers, designing infrastructure and processes that increase access to quality, affordable care, and advancing health equity. She is the Chief Operating Officer at Community Clinic. So thanks again, both of you, for joining us, and I'll pass it over to you two.
Thank you so much, Kara and Kiana. Wow, I have so many notes and I can't wait to dig further into your resources and share this information with our team as we look to the future of our community-supported agriculture program at Community Clinic. So that's what we'd like to share with you more today, and how we are improving health outcomes through community-supported agriculture programs at our health center. Like Kara said, I'm Amanda Echegoyen. I'm here today with my colleague. I'll let him introduce himself.
Hi guys, my name is Aileen Gideon. I'm the Special Programs Coordinator at Community Clinic.
Excellent. We can go to the next slide. There we go. Okay, so just a little bit about where we are and who we are and what we do. Community Clinic is located in Northwest Arkansas, in the northwest corner of the state. Some of you may recognize Northwest Arkansas and the cities that make up this region as home to some very large global corporations, including Walmart, Tyson Foods, J.B. Hunt Transportation. We have a regional population that is nearing 600,000, and that makes us the 100th largest MSA in the United States. Approximately 18% of our population in Northwest Arkansas is Hispanic or Latino, and 6% is Asian Pacific Islander, and we'll hear more about that from Aileen in a few minutes, but Springdale, Arkansas is the home to the largest population of Marshall Islanders outside of the Marshall Islands. So Community Clinic serves this growing and diverse region through 20 locations and a mobile unit. We have approximately 325 team members, the majority of whom are bilingual, and we treated over 45,000 patients in 2023. Around 2/3 of our patients prefer to receive care in a language other than English, and around 3/4 live at or below 200% of the federal poverty line. The services that we provide include primary care, pediatrics, dental, prenatal, integrated behavioral health, and just a variety of supportive services to really help patients achieve optimal health outcomes. And we are positioned to continue to grow in our community as the area continues to grow. And we can go to the next slide, and we are going to hear more from Aileen about the Marshall Islander population in Northwest Arkansas.
Thank you, Amanda. So just a brief summary about the Marshall Islands. The Marshall Islands is located halfway between Hawaii and Australia. The Marshall Islands, alongside its sister nations, the Republic of Palau and the Federated States of Micronesia, has a special relationship with the U.S. government called the Compact of Free Association, or COFA. This contract allows COFA citizens to travel freely and live and work in the country without a visa and with no time restraints. So the migration of Marshallese started in the late 70s when a Marshallese man named John Moody migrated down here to Arkansas with his family and worked for Tyson Foods and started bringing families, friends, and the population started to grow. Job opportunity is one of the reasons why we are here. Now we have an estimate about 15 to 20,000 plus Marshallese residing in Arkansas, and Arkansas has the largest population of Marshallese, second to the Marshall Islands. So some of you may know that the Marshall Islands, as well as other Pacific Island nations, and for many years have been advocates for climate change and nuclear justice. During the World War II, the US government tested 67 nuclear weapons in the Marshall Islands, and to be specific, Bikini Atoll, resulting the islands to be irradiated and left many with underlying health issues such as cancer. More so, Marshallese went overseas to seek medical treatment. Just last week, the federal legislation restored federal benefits to Marshallese citizens, and a huge win. However, for many years, we have been excluded in these benefits and prevented many from healthcare access throughout the years. Benefits that includes Medicare, SNAP, and with the large population of Marshallese in Arkansas and other states, we now are able to have these available to us. I also want to acknowledge and give thanks to Congress leaders, community partners, and members such as APCHO, NAUPO, BOW, ACOM, and the Marshallese community leaders near and far for being our voice in the fight. Just wonderful news to hear. Great work. Next slide.
Thanks, Aileen. That is truly wonderful news. As the primary medical home for many Marshallese in the Northwest Arkansas region, that is exciting to know all of the advancements that will continue to impact health equity in this population. We are proud to serve as the medical home for many Marshall Islanders, as well as other culturally diverse populations. And so when we were approached about implementing a CSA program at our health center, we knew this would be an invaluable opportunity to integrate the food as medicine concept with our diverse patient population. So our CSA program began in 2021 as a pilot with a local food hub whose goal is to connect farmers to community and put local food on local tables. And in contrast to traditional CSA programs, where members purchase shares in one lump sum in advance of the growing season, the idea of this pilot was to be more inclusive of all income ranges by allowing members to opt in and out throughout the growing season as they're able, and to pay each week when they pick up their produce bag instead of one lump sum in advance. Another goal with the pilot was to reach culturally and linguistically diverse populations that may not be familiar with or would participate in traditional CSA programs. So we saw this as a truly innovative way to reinforce many of the health and dietary concepts that our providers and staff are working with and talking frequently with patients about every day. So to begin this program, we conducted focus groups in Spanish and Marshallese, and we partnered with Brightwater Culinary Institute to prepare a meal using locally sourced produce for the focus group participants. There was an opportunity to learn more about those cultural preferences and how we could design our program to be inclusive of cultural preferences and different culinary practices. We used this information then to launch our program in the spring of 2021 at one community clinic location. We had an average of 35 participants per week during the 2021 growing season. And participants came to the clinic and paid $10 to pick up their produce bag or $5 with SNAP benefits each week. We later expanded in 2022 based on provider and patient feedback to expand to more locations. We had support from local funders that really helped us increase that access by providing food storage solutions to 8 community clinic locations. And so we were able to provide produce bags for some patients at no cost as well with that grant funding. In that growing season, we averaged around 200 participants per week. And a really neat outcome of this was at the conclusion of the growing season, we surveyed participants, and over 70% of the patients who participated reporting having better access to produce, consuming fewer processed foods, and having a better understanding of how food impacts health. In 2023, we averaged about 100 participants per week. And due to some changes with our food hub partner, we did reduce the number of locations, pickup locations from 8 to 4, but we worked really hard to maintain access for patients to the produce program, including adding in a local poultry plant as a pickup site to ensure access for those participants. So far in 2024, we have had an average of 75 participants per week, which we are really proud of because the growing season in Arkansas really doesn't start until May. So to have had 75 participants already opting in, our food hub partner has been fantastic to work with different food hubs in the area to source produce throughout the winter months so that we can continue to provide that access for our patients during the winter months. And we really look forward to May and June when the growing season really does pick up to increase that enrollment. And on the next slide, we can see some of the examples of materials around our CSA program. So Spring Creek Food Hub is our partner. You'll see their logo there. These are the enrollment and marketing flyers and the sign-up agreement, and also an example of the health tips. We include health tips and recipes in 3 languages in the bags each week. And like I already mentioned, participants enroll on a monthly basis and come once a week to pick up their food bags at the location that's most convenient for them and make payments every week when they come. And I'll now turn it over to Aileen again to tell us more specifically about how this program has impacted the Marshallese community that we serve.
Thank you, Amanda. And so with the federal benefits restored, Marshallese families are able to apply for SNAP and can go to a local farmer's market to purchase fruits and vegetables. And according to the American Diabetes Association, about 15% of Arkansans have diabetes, while nearly 40% of Marshallese adults living in Northwest Arkansas have the disease. Community Clinic's CSA program with the partnership of Spring Creek helps low-income families or the community in general to purchase healthy and affordable food items for just $10. Back in 2021, we had brought in a Marshallese focus group to identify their food preferences on fruits and vegetables, to bring back to Spring Creek for them to add fruits and vegetables our Marshallese patients are familiar with to the bags. Some of the preferences they listed were apples, bananas, orange, papaya, broccoli, and carrots. These are some fruits and vegetables they were familiar with. And to have them in the weekly produce bags, to me personally, gives a sense of inclusion. There would be times where they would get some items that they weren't familiar with, like squash. Amanda and I had done a Facebook Live on how to bake squash. Um, we don't have squashes back home in the Marshall Islands. However, we do have breadfruits and coconuts. Um, so back to the Facebook Live, um, you know, to have that posted on our Facebook and to see the views go up in time, I had I had this one Marshallese lady come up to me one day at the clinic. She was like, "Hey, I know how to make baked squash from the video you made," and that was very exciting to hear. And at least we reached somebody. Community Clinic serves the largest population of Marshallese and Hispanics in Arkansas, and majority of them work in the poultry industry. Community Clinic has a strong relationship with local companies like Tyson Foods with our CSA program. Most of our patients work at Tyson. However, with their busy schedules and responsibilities, some of their team members are not able to stop by the clinic to either schedule their appointments or pick up their bags. And to eliminate structural and hidden barriers, we bring our produce and our services to them, and we're able to bridge gaps and have healthcare access to their team members for the team members. We are currently servicing two of Tyson Foods plants in the talks on bringing the produce to another Tyson location in Rogers, Arkansas, and hopefully we can be able to bring the service to them as well. So you see, understanding the needs of our patients is essential. And, we strive to do more. We need to do more because the population is growing. Community clinic is one of the places where people in the community is familiar with. For example, I wanted to buy fresh local produce. I'm not familiar with the farmers market around here, and I'm not really good at speaking English. And, oh, hey, I enrolled in the CSA program at Community Clinic. I do have an appointment tomorrow. I can pick up my produce bag there after my appointment. Accessibility, having this kind of service in every healthcare system that is well diverse, give each and every one of our patients a sense of community. With the help and support from the American Heart Association, we are able to educate both patients and community members on cooking education. Oh, I'm sorry, I forgot to, um, the next slide. Um, Not all of us know how to incorporate our everyday meals with veggies and fruits. Yes, we do have nutritionists, but that's just it. We want to be able to impact um, our patients. Um, so we started the Cooking Matters class to really educate our patients on healthier eating and purchasing groceries for less to save money. Um, the program is a 6 week long program, and we want to know what dates and time work best for our participants. Going back to Tyson's busy schedule, we want to accommodate our patients and encourage them to on like importance of what we eat, especially when you are in a different country and you are not familiar with the food. In the Cooking Matters class, we teach in both Spanish and Marshallese. And for our last class, we do a store tour, taking our students to the store to compare expenses. Um, One of my students said that she would always just grab whatever item she sees without looking at the price. And we got a lot of great feedback from the first group of participants, and seeing the success on that, I can't wait to continue the class next month. Our patients don't just get to learn how to cook, but why they cook. And our main focus is to promote overall health. Um, as you can see on this slide, we were at Tyson and we were selling these produce bags. Our cooking matters class, also our cooking matters class, and where we store our bags. You know, future plans, our hope for the future is to educate more of our patients on healthier eating. Um, try to, enroll more into the CSA program and creating a strong relationship with a local NGOs or companies and to encourage blue collar workers to participate in the program. And most importantly, supporting our local farmers. Uh, yeah, so I hope you all learned something from this little presentation. I hope it was informative. Como Tada Alip, thank you, Apcho, for having us today as one of your presenters. Thank you to the presenter before us, phenomenal work. I learned a lot. So if you have any questions that you would like to ask, we will be here. Thank you, guys.
Thank you so much, Ailing and Amanda, for sharing with us and for the incredible work that you do to support the Marshallese community in Northwest Arkansas. I'm so grateful to you two and Kiana for your profound thoughts and also practical solutions. I realize that we're at the top of the hour and people will be leaving, but I was hoping that if anyone had any questions, that y'all had a chance to get your questions typed, answered in the chat, and we will be sharing those afterward. And then I wanted to just run through some of the resources very quickly so that people watching the recording will understand how they work. So we do have a plethora of resources for our audience today, and we do not have time to walk through each one individually, but I encourage you to click through them all on your own. So the first slide is more foundational research, books, articles, podcasts, and other ways to build a more advanced understanding of this topic. The next two slides have both national and local level financial resources and collaborative opportunities for health centers and other organizations to get support for implementing or sustaining work to advance food justice, access, and sovereignty among your health center populations. And for example, this includes grants, scholarships, endowments, capital planning, and other financial assistance. The next slide the next two slides have implementation plans, toolkits, templates, and other resources for establishing your own action plan or program to support your health center population or community food needs. And I'm sure there's more resources that I missed, so I'm definitely going to ask Kiana, Amanda, and Ailing to share further resources. And then I want to just take a moment to name that we have one more session next week. It's session 4 on team-based approaches for managing complex health needs. That will be moderated by Migrant Clinicians Network, the National Center for Equitable Care for Elders, the National Nurse-Led Care Consortium, and the National Network for Oral Health Access. And if you'd like to register for that, you are already registered if you're here, but if you'd like to share the registration for that, we will pop a link in the chat. And then very last, thank you from all of the organizers. We will be sending out recordings, slides, and transcript to all registrants for the series, as well as posting them on pophealthtaskforce.org. And if you could please take a moment to complete the evaluation, it will pop up when you exit the room. There's a link to it in the chat. And if you don't have time to do it today, it will also be included in the follow-up email. So thank you so much, presenters, and everyone for being here, for staying a few minutes past the hour. I know y'all are busy. Please get rest this weekend, and it's Wednesday, so it's not the weekend yet, but I'm normalizing that. Okay, I'm gonna stop myself. Thanks so much, everyone, and have a wonderful rest of your day.